Thanks so much, Stephen, and it's great to have everyone here together today. I'm pleased and privileged to welcome Jonathan Nguyen. Jonathan, welcome.
Hey, Mark, how are you?
Great, it's great to have you here with us.
Yeah, thank you.
So why don't you share with the audience your title and organization and a
Yeah,
bit about your background?
great. Well, first, many thanks for having me here. My name is Jonathan Nguyen. I'm a vice president and a field CISO here at Fortinet, and Fortinet is the industry's largest pure play cybersecurity company with a very broad portfolio of security technologies. And my job really is to work with security teams around the country and around the world and take the 25 years of cybersecurity experience I have and apply that with our technology to really just get things right in cybersecurity, in particular healthcare. By background, as I've said, I've been doing this for 25 years. So that dates me back to the dawn of 1990s and point defense products and things of that nature. And I spent 16 years at a very large carrier where I was part of the MSSP team. And then I was part of their data breach investigations team report. So a lot of experience as a virtual CISO, helping organizations around the world, and then threat research into the root causes of data breaches and disruptions.
Wonderful, perfect. So let's talk a little bit about the moment that we're in, which is a bizarrely fascinating one in the middle of this global pandemic.
Right.
How would you say that what has happened during the pandemic so far might have accelerated digital transformation, macro trends that were already on the road in healthcare?
Yeah, so healthcare, like a lot of industries, going into the pandemic, was really being shaped by digital transformation, the forces of accelerated data-driven decision-making, if you will, changes in borderless networks and the acceleration of performance and just overall complexity. And the pandemic really accelerated that, right? So going into the pandemic, we saw a couple of things that we had never seen before. Tectonic macro changes in IT. Typically in IT, we had the yin and yang between distributed and centralized computing. But now what we saw was simultaneously, we had a huge acceleration in cloud adoption, centralized computing. And at the same time, we had a mass movement of our staffs from inside the perimeters to remote working locations, right? So edge-based computing and distributed computing. And at the same time, we are also seeing the rise of 5G and more IoT devices and IoMT devices and OT devices throughout our organizations. And as the pandemic is winding through right now, and there's hope that there'll be a therapeutic or a vaccine that's effective in the next couple of months, but I think it's going to change things, and it's going to change things around this notion of contactless commerce in healthcare, telemedicine, if you will, and that traditional notions of what work is changing, and same thing in healthcare. How we think about healthcare services, how they're delivered, how they're consumed, how they're conceived is going to change. The way we go about accessing healthcare, whether it's going to be in our homes, at remote branch offices, if you will, or in traditional facilities and clinics. We have both clinical functions and non-clinical functions that are going to be virtualized. And so I think the big changes that are occurring in healthcare are, one, that the digital infrastructure is more important than ever, and it's going to be far more distributed than ever. It's going to be not only the average of 15 IP-enabled devices that are connected to a hospital bed in North America, but the idea that now we're going to have to provide those types of network performance at remote locations, along with security, because you've got life and limb issues, right? And you've got compliance issues. And the challenge is, can you really deliver that level of quality, resilience, and security from many remote locations across millions of simultaneous connections, per minute? So that's the challenges we're seeing in the acceleration of those forces.
Exactly. Well said. So it sounds like we're headed into a new normal.
Yeah.
What does a really strong cybersecurity regimen look like in this new normal? Starting at like a 40,000 foot up view, and then we can drill down a bit.
So I think going into the pandemic, one of the things that if you look at the last 25 years in cybersecurity, we saw complexity as the main issue why organizations were failing. And complexity because the sheer amount of devices being monitored, the number of users that are attempting to get network access, in addition to the number of entities that are trying to get network access. So the level of complexity created gaps. And those gaps are typically where security problems occurred, whether it's someone exploiting a vulnerability that hadn't been patched, for instance, or whether it's the device that's misconfigured, but no one saw that, or whether it's a 0-day that couldn't be detected, or whether it's an insider threat. In fact, going into the pandemic, the biggest threat vector for healthcare was the insider threat. It was people accessing information illegitimately and using that information for nefarious purposes. Now, as more and more of our employees are working remotely, we're seeing ransomware and phishing attacks as the primary threat vector. In fact, one of the results of the pandemic have been very targeted and specific attacks against healthcare providers in the form of ransomware. And ransomware both for disruptive reasons, just to disrupt operations and notoriety, as well as for financial gain, but mostly for financial gain. And it's not just the ransom. In some cases, it's wiperware where you see the destruction of data. And so these are not new forces, but what they are is they add the level of complexity, the level of variety, and certainly the velocity of targeted attacks against healthcare.
So my thoughts are going down two different lanes at once here.
Yeah.
One is security as a foundation for a good end user experience.
Yeah.
And at the same time, how you create security driven networking. You can take those in any order.
Well, the two are really linked because when I speak with healthcare providers and IT teams and security teams in those organizations, they'll tell you that patient care comes first, but that today the digital infrastructure of any enterprise, healthcare or otherwise, is really dependent upon two pillars. That security and networking are working hand in hand. That the session that you have is only valuable and is a good experience if it's secure. If it's not secure, no one's going to use it, right?
Yeah.
But at the same time, if you don't have high reliability, low latency, low jitter, and a good experience, meaning that the WAN, the network access piece, has to be optimized. So are you trying to access that application or that healthcare provider? Is it over 4G, 5G? Is it over commoditized commercial broadband, or is it through MPLS? You know, the other thing that's coming through right now is that the SD-WAN component, the WAN optimization element, is really key in delivering that customer experience. Give you an example. I spoke with the CIO of a pretty major healthcare provider here in North America, and he said, look, literally as the pandemic began, we went from on-prem in-person call center operations to remote working. And they went overnight using the Fortinet SD-WAN capability, which is integrated at no charge into the FortiGate firewalls. And by leveraging that SD-WAN capability, he was able to immediately shift work from call centers to home environments. Now, the most amazing thing over 15 weeks is he said, look, we had 0 complaints. And that's remarkable. Anyone who's ever worked in a call center, and I have, that's an amazing statistic, because to serve folks remotely during a time of stress and to have people working from home where they're also facing stress and distractions and have 0 complaints about quality of service, that's just an amazing thing. And it demonstrates that security and network performance really are integral to delivering that customer experience and that healthcare outcome, right?
I think you're bringing a really important perspective here, because I think for many non-security people in patient care organizations, especially clinicians on the front lines, when they think of security, they think of it as something that in their lives, they understand in the abstract that it's important, but in their lives, it's kind of like bothersome, right? It's this, you know, you have to do more passwords, or you have to, you know, biometric or whatever, that everything that goes into security ends up being an encumbrance or a barrier or a challenge.
Yeah.
How do really smart IT security leaders in patient care organizations flip that script and help frontline people, clinicians and others, to understand that actually you're really helping them. You're
Yeah.
not just putting things in their way.
Yeah, I think today the digital infrastructure is so integral to the way that healthcare is provided, and that everything that that clinician uses, you know, any healthcare provider, doctor, nurses, analysts, otherwise, they all access applications and workloads that are IP enabled. I think that's part of the digital transformation of healthcare, right? So I still remember, because back when I was an undergrad, I worked in an emergency room, and everything was done by a paper, from the ambulance engagement all the way to the admission into the hospital through patient care, were done by multiple versions of documents that had to be filled out. That's no longer the case. And so the way that you think about security is, how do I integrate security into my digital infrastructure, my workflows, so that it's seamless, that it's in the background. And that's core to what we do at Fortinet, which is that we manage complexity, and we help that through consolidation. You consolidate to manage complexity, and you make what is complicated less complex and more seamless. And when you take a look at the way we integrate our fabric technology, and just the way we integrate things like SD-WAN and security functions like next generation firewalls, that's how you do it. The way that you as a IT team help frontline providers understand that it's there is to make it seamless. They shouldn't have to do any additional steps to enable security. That's what we do, right? And so yeah, but it's the same way that they don't need to worry about the machine shop. They're not out there doing the maintenance on the ambulances, right? But with that many IoT medical devices that are in use now, that many workloads that are involved, yeah, it needs to be in the background.
Great. Well, let's begin to move toward concluding by what are the top 2, 3, 4 things that you think leaders need to do right now in this area, regardless of where they are on their journey.
Right. So I think the first thing they need to consider is implementing a zero trust strategy as a basis of their security program. The idea that everything and every person attempting to access their network, to access a workload, that request is identified, the device and user are identified, authenticated, the request for access is validated, so it's a valid request, then logged and monitored, and then the final disposition of what was accessed is determined as well. Take that strategy and then align it to technology. So the best way of approaching security is, what is it I'm trying to deliver in terms of a reasonable level of care? Zero trust is one way of doing that. Basic controls like the CIS-20 controls are great. And then once you decide upon the right strategy and the right policies and controls, then think about the best way of employing technology rather than the other way around. I would say, before you buy any new widget or platform, make sure that you define what it is you're trying to achieve, and then say, okay, now that I want to implement zero trust, what's the best form factor? Is it going to be an appliance, a virtual machine? Or will it be from the cloud in terms of a SASE solution? You have things like firewalls as service and secure web gateways as service and cloud services. And at Fortinet, that's what we do. We provide all of those capabilities in a form factor, and a consumption factor, and a licensing methodology that best suits the customer. So you decide what you're trying to achieve, and then the best way of implementing those goals, and then we provide that technology.
Great. What does this landscape look like 2 years from now?
I think it's going to look far more complex again. I think, and far more accelerated. If you look at the underlying dynamic of data-driven decision making, it's all about more data and accelerated basis, leveraging AI. So across your business platforms and security platforms, we've evolved from point defense prevention platforms, and then detection platforms like SIEM and analytics tools. Now we have orchestration. AI is the next engine, because the only way to process that volume of data at that velocity of that variety is leveraging AI. And so when you take a look at the technology you utilize, make sure that there's a sound and proven AI capability that's integrated across that prevention, detection, orchestration platform.
That's wonderful. And do you feel, on a scale of 1 to 10, I guess, how prepared are the information security leaders in hospitals, medical groups, and health systems right now to really begin to carry out this set of tasks?
You know, I think the leaders are prepared because they understand it, they see it. Everyone I've spoken to gets it. I think the principal challenge has been am I going to get enough funding? Do I have enough time? Time and money are the main issues, is rather than awareness. The good part is everybody gets it. The second part is how do we go about prioritizing that, and how do we go about implementing it in a sound and reasonable fashion. But at the heart of it is providing patient care. And I think that's going to be the strive first. It's going to be mission first, customer first, patient first, and then followed by the security and compliance requirements.
Wonderful. And do you sense that federal authorities are going to make it easier that they'll facilitate regulatory changes that will help this process?
I think the regulations are in place. It's interesting because one of the things that people tell me is that the only thing that didn't change during the last 15 weeks was the regulatory compliance requirements. You know, that didn't change at all. You're still bound to HIPAA. You're still bound to Sarbanes-Oxley. You're still bound to any number of standards or regulations that each organization faces. I think that what they will do is provide more resources, and what the federal government and state and local government can do a better job of is information sharing, threat research sharing. And that's one reason why, you know, at Fortinet, what we do is twofold. One, we partner with the US government, Canadian governments around the world. We're a founding member of the World Economic Forum Cybersecurity Forum, for instance. We're a founding member of the Cyber Threat Alliance. And governments and industry can do a couple of things. But one, providing faster, accurate information to security teams in healthcare and otherwise is a great way. In addition to that, we've opened our network security academies, all 8 levels, at no charge to the public, so that we can get more and more people up to date, whether they are just a consumer, citizen, or whether they're a security professional, giving them that security awareness training that's critical. We're all digital citizens now. Yeah.
Wonderful. Well, thank you so much, Jonathan. Any parting words before we turn it back to Stephen for question and answer?
No, great. No, I think we're on our way. Appreciate your time today, and let's take care of the basics and security hygiene and solve that complexity issue. And I think we'll go a long way towards securing healthcare.
Wonderful. Thank you so much, Jonathan. I'm going to turn it back now to Stephen.